Hello there. My name is Shelby Van Cleve, and I'm a licensed acupuncturist and the owner here at Common Ground Wellness Louisville Acupuncture Clinic. Thank you for choosing us to be your acupuncture provider. You have choices as an acupuncturist here at Common Ground Wellness. It's likely that you'll see more than one practitioner, and even more likely that you will settle on one as your primary practitioner. I encourage you to find someone that you feel comfortable with, but I assure you, you will receive the same quality care and effective treatment no matter who you choose to see. In this video, we're going to cover a number of topics. There are a few things that you should know before you come in for your first appointment. First, it's very important for you to fill out the new patient paperwork. Plan to be with us for an hour and a half when you first come in. We will do a very thorough health history in the first hour of that appointment, and in the second half, you'll get your first acupuncture treatment. In that health history, I'm going to ask a lot of detailed questions that may seem unrelated to what you're coming in for. But acupuncture is part of Chinese medicine, which is a complete system of medicine, and we look at you as a whole person and not just the sum of your symptoms. In that first appointment, after we finish with our interview, I'll do a couple of diagnostic techniques. I'm going to feel your pulse, and I'm going to make you stick out your tongue, and I'm probably going to poke around on your belly. When I feel your pulse, I'm not looking at your blood pressure or your pulse rate. Each radial pulse has 3 different positions, and each relates to a different organ system. So through my questioning, I come up with an idea of what I think is going on, and then the pulse and the tongue are my system of checks and balances. So I can check in with the organ system and see what it feels like in your body. When I have you stick out your tongue, I'm looking for more climactic conditions. Some people are too hot, some people are too cold, some people are too dry, some people are too damp, and we see these kinds of climactic conditions on the tongue. So these are traditional diagnostic methods we use in Chinese medicine, and you'll expect to go through these when you come in for your first appointment. In your second appointment, we will go over the details of that treatment plan, and in all the subsequent appointments, we will just focus on treatment and checking in about symptom progress. We talk about health very differently in Chinese medicine than we talk about it in Western medicine. In Chinese medicine, we classify disease according to organ systems. In Chinese medicine, these systems are named for organs. So we have the liver system, the kidney system, the spleen system. Just because your diagnosis contains an organ doesn't mean that there is an organ pathology. In fact, more often than not, it's actually the trajectory on which that organ communicates with the other organs in the system. This is known as the meridians in Chinese theory, and these are where the acupuncture points lie. I feel it's very important for you to understand your Chinese medicine diagnosis. So in that treatment plan, I try to be as clear as I can about what your diagnosis is, and then you can do some more research on it so that you can understand where I'm coming from. So we will talk about your Chinese medicine diagnosis in your follow-up appointment the second time you come into our office. I will also make a number of recommendations for you. So I give you tools and options of things that you can do to really help yourself. I will tell you what I plan to do for you in terms of modalities within my scope of practice I deem most appropriate for your constitution. Acupuncture is, of course, the most well-known, but we also do moxibustion, cupping, massage, some essential oils, herbal therapy, dietary therapy. Acupuncture is rarely a one-hit wonder. It's a therapy. It's something that you have to do with some consistency to really get the benefit from. In terms of treatment effectiveness, this depends on a couple of things. How long you've had your symptoms, how severe they are, and how robust your constitution is. If you are generally healthy, we're probably going to get those things to shift pretty quickly. But if you have a lot of other things going on, heart disease, diabetes, it's going to be a little bit more difficult to get those things to shift. But I usually like seeing something shifting between the 3rd and the 5th treatment. And by shifting, that doesn't mean that all your symptoms are gone. Maybe you are sleeping better. Maybe you're more capable dealing with stressful circumstances. These are signs that the acupuncture is working, and eventually your chief complaint will start to see the beneficial effects of that as well. When you come in for a particular symptom, say you have low back pain, that doesn't necessarily mean I'm going to stick the needles in your low back. I'm probably not going to stick any needles in your low back. I'm going to use your hands, your feet, your head, your ears, And then I may go locally with another modality, such as cupping or moxibustion. That is the theory of acupuncture. We use distal acupuncture points to draw the inflammation out of the area of pain. You don't want to add more congestion to an area of congestion. Instead, we put acupuncture needles in distal locations that help draw the inflammation out of that local area. And then after the inflammation has calmed down in that area, then we may go in with a couple of acupuncture points, a few treatments down the road. Another frequently asked question is, how many needles do I use in a particular treatment? And again, this varies depending on what we're treating. But I think about 10 is a good number. It could be less, it could be more. You're not going to get the exact same treatment every time you come in. Sure, you may be coming in for headaches, but sometimes you're going to show up and you haven't slept well that night, and that's going to affect how you present that day. And I'm going to change what points I choose depending on how you show up in my office that day. These are my acupuncture needles. They're about the size of a human eyelash. They're bendable and flexible. They're solid, sterile, single-use, disposable needles, so we only use them once and then they're thrown away. About 18 of my acupuncture needles will fit into the head of a standard hypodermic needle, so they're very small as compared to anything that you've been poked and prodded with in the past. So when I find the area that I'm going to treat, I'm going to stick the needle in, just like that. I actually didn't feel that needle go in. Often I do, and what it feels like is someone pulls a hair on my arm, so it has a very minor prick associated with it. Sometimes it feels like pressure, sometimes it feels like nothing at all, and sometimes it'll have a slight sting associated with it, but it's fleeting. It's about a second and then it's gone. Same thing with the acupuncture. Once the needle's in, sometimes you don't feel anything at all, but sometimes it can be tingly, warm, slightly achy. You may feel a sensation travel along the muscle fibers. You may feel something else in a completely different area of your body light up. To have a sensation associated with the acupuncture is generally a good thing, but it should not be painful or uncomfortable. And if it is, you'll let me know. Once I have gotten in all the needles that I'm going to do for the day, I'm going to make sure you're comfortable. I may put a heat lamp on you. I may cover you with a blanket. I'm going to play some nice music. I'm going to bring the lights down low, and I'm going to step out of the treatment room for about a half an hour. If at any point during that time something's not okay, please do not hesitate to call me. Examples of things that may not be okay: you've got to go to the bathroom really badly, one of your needles is really bothering you, maybe you're having a panic attack because you're prone to anxiety. Whatever it is, please don't hesitate to call me. Examples of things that you don't need to call me for: if you do have the heat lamp on you and it gets a bit too warm, you can push it out of the way, or if one of your needles pops out, your body's done with it, and that's just fine. I'll find it when I come back in the treatment room. During this time that I'm outside of the treatment room, most people fall asleep or fall into a really relaxed state. And when your time is up, I'll come back in and take your needles out. Acupuncture causes a head change. In the trade, we call it acustoned or aculand. It's generally a pleasurable sensation, but the first time or two you experience it, it may feel like you're dizzy or lightheaded. So please take your time getting up off the table until you know how your body's going to respond. But once you get used to what goes on here at Common Ground, you can let your guard down and really relax in your treatments. In terms of side effects, sometimes there's a drop of blood at the insertion site. I will hover over with a cotton ball and get that cleaned up as best I can, but if I miss anything, there are tissues for you to use. The most common side effect is that you may occasionally get a bruise, especially if you're anemic, on blood thinners, or just tend to bruise easily. Second most common side effect is that points can be kind of achy after treatment. This has kind of a burning sensation similar to after a heavy workout or a deep massage. You are more likely to be achy if you move your body parts around with needles in them. If you engage a muscle that has a needle in it, you're probably going to experience some achiness. So it's best to stay still during your treatment. It normally dissipates within 24 hours, and if it doesn't, you can call me and I can give you some ideas of things you can do to help it along. Third most common side effect is that when you get up off the treatment table, you could be kind of dizzy or lightheaded. This is especially true if it's your first treatment. Acupuncture acts as a catalyst. It has this special quality that allows you to figure out what needs to happen next. It's pretty difficult to articulate exactly what that means, but it's life-changing to say the least. Yes, you may be coming for insomnia, but with consistent treatment, you will find that other areas of your life that were stuck suddenly become unstuck, and you're moving forward on your path in a more productive and effective way. Most acupuncturists have the same level of education as your primary care doctor. I received my undergraduate education at Indiana University, where I created my own major in pre-medicine, Eastern philosophy, and nutrition. Once I graduated from IU, I entered the master's program at the Oregon College of Oriental Medicine, where I spent 4 years being trained as an acupuncturist. Hopefully you found the information in this video helpful, but if you have any additional questions, please feel free to vocalize them in your initial appointment. I am used to fielding all kinds of questions, comments, and concerns, and I encourage them because it's my job and my desire to put you at ease before we get started. We look forward to taking very good care of you.